What is anesthesia? Anesthesia refers to the use of medications called anesthetics to keep you from feeling pain during procedures or surgery. Anesthetics temporarily block sensory signals from your nerves at the site of the procedure to the centers in your brain. Some anesthetic medications numb certain parts of your body. Other anesthetics numb your brain so you can sleep through more invasive surgical procedures. Types of anesthesia. Local anesthesia. This numbs a small section of your body. Providers commonly use local anesthesia for minimally invasive procedures like cataract surgery or skin biopsy. You're awake during the procedure. Sedation. Also called twilight sleep, sedation relaxes you to the point where you'll nap, but can wake up if needed to communicate. Examples of procedures often performed with sedation include wisdom teeth removal, cardiac catheterization, and some colonoscopies. Although you won't be completely unconscious, you're not as likely to remember the procedure. Regional anesthesia. Regional anesthesia blocks pain in a larger part of your body, like a limb or everything below your chest. Examples include an epidural to ease the pain of childbirth or an arm block for hand surgery. Providers might administer regional anesthesia in addition to sedation, or they may administer it by itself. General anesthesia. This treatment makes you unconscious and insensitive to pain or other stimuli. Providers use general anesthesia for more invasive procedures or surgeries of your head, chest, or abdomen. Treatment details. Who administers anesthesia? If you're having a relatively simple procedure that requires numbing a small area, the provider performing your procedure will often administer the local anesthetic. For more complex and invasive procedures, a physician anesthesiologist will prescribe the anesthetic medications and manage your pain before, during, and after surgery. How to prepare for anesthesia. Make sure your healthcare provider has a current list of the medications, vitamins, and other supplements you take. Certain drugs can interact with anesthesia or increase the risk of complications. You should also avoid food and drinks for 8 hours before you go to the hospital, unless directed otherwise. Quit smoking, even if it's just for 1 day before the procedure, to improve heart and lung health. For best results, stop smoking 2 weeks before your appointment. Stop taking herbal supplements for 1 to 2 weeks before the procedure, as directed by your provider. Stop taking Viagra or other medications for erectile dysfunction at least 24 hours before the procedure. Take certain, but not all, blood pressure medications with a sip of water, as instructed by your healthcare provider.
For more, please subscribe to Idea TV at Idea Television.